Hi there, and welcome back to My Blooming Health Mobile. This is our second episode here, and today our topic is preparing you for an unexpected hospital stay. My name is Danita Smith. I'm a registered nurse, and with my experience, I am helping you to bloom yourself to better health. Talking today about an unexpected hospital stay. We have to think about the younger people, the 30s, the 40s, the 50s, the 60s. We don't always prepare for different ailments such as what a 90-year-old may be facing. So that's what I'm here to talk to you about. If you are hospitalized unexpectedly, I wanted to give you just a few pointers as to what to expect and what you can do to make yourself feel a little bit more comfortable in that situation. You want to make sure that you know which hospital is the best option for you. There's a lot of things that you need to consider, one being your insurance. Will that hospital take your insurance? If you have no insurance, what financial options do they have for you? A lot of hospitals have financial advisors available that can come speak to you and your family. During your relationship that you have with your doctor, make sure that you know which hospital that they go to. Just because they're in your area, it doesn't mean that that doctor will go to every hospital. You also want to make sure that your insurance is covered in that hospital. Say, for instance, if you have Blue Cross or Cigna, I'm just throwing something out there, United Healthcare. Whatever plan that you have, you want to make sure that it is covered in that hospital. And you can do that by just calling their financial office prior to anything happening to you. You ask for the financial advisor or a social worker, and they can assist you. If you do not currently have a primary care physician, whether you have health insurance or not, try to find one. Get established with the doctor so that they know your baseline. And in the event that you are hospitalized, they have something to go off of in regards to how to better treat you. Number 2, are you employed? If you are employed, you need to think about your employer if you are hospitalized. Matter of fact, you don't want to think about your employer while you're hospitalized. So you want to make sure those things are taken care of up front. When you're first hired, or if you've been there for 20 years, you need to go back and ask about the FMLA Act. At least know the basics so that you know what kind of time you can take off, that your position is still protected, who needs to fill out the paperwork. 9 times out of 10, it's your doctor. So you need to get that, have somebody available who can get that paperwork for you while you're hospitalized, and not wait until you're out of the hospital and then you're rushing at the last minute trying to get everything approved by your employer, and now you're stressed out again. So make sure you know about your FMLA, your Family Medical Leave Act, prior to you becoming ill. Let's talk about number 3. Number 3 is in regards to what your insurance company will pay. In today's world of healthcare, the typical length of stay in a hospital is 3 to 5 days, depending on what your diagnosis is. Just 10, 20 years ago, you could stay in the hospital for 1 to 2 weeks for that same issue. But times have changed. The doctors still have a lot of say as to how long you stay in the hospital, but the insurance companies, the hospitals, they have a lot of input. And some things are kind of cookie cut, depending on what your scenario is. So you want to make sure what your insurance company will pay for. And one of the reasons I need to point this out to you is we get a lot of patients who are hospitalized and they still may have a little tickle in their throat, or they still might have a slight headache. Something that can be managed at home. When the doctor is trying to discharge you, you really need to listen to the advice of your physician. The 4th thing I want to talk about is knowing who to talk to while you're in the hospital. There are so many people running around the hospital, a million people coming into your room. Everybody have on scrubs, everybody have on a lab coat. So you don't know who's who. Make sure you ask questions. Nowadays, a lot of hospitals are giving you like a little form where you can keep track of all the names and people who are coming in and out. You can, if a question pops in your mind, you can quickly jot it down. If they don't provide you with that stuff, bring your own stuff. Have your own pen and paper handy and ready. So your physician, for one, you want to know that you have a charge nurse, like on the unit, on that nursing unit where you belong. There is your staff nurse who's dedicated to you and a few other patients, but there's also a charge nurse or an assistant nurse manager who's over the entire floor, who knows exactly what's going on. Not for each individual patient, but she knows how to manage your care. He or she can manage your care. So if in the event that you're unhappy with the care you're receiving, or in the event that you want to compliment somebody with the care you're receiving, or you can't understand what the next steps are, there's a charge nurse that can kind of help guide you. So remember to ask for a charge nurse. Now, there's typically also a hospital supervisor, somebody who literally floats throughout the entire hospital, up and down between the units, to check on each department and make sure everything's going okay, and as well as expected. These are the people that you can ask for if you're really having some serious issues. You don't know what the next step is. Everything seems confusing. Everyone has conflicting stories for you. Just know, so you have your doctor who you need to speak to first. You have a charge nurse if you're having some issues that you feel like are not being addressed immediately. And you have the hospital supervisor that needs to get involved if you feel like it's whatever you think is a critical event. Just know that those three key people are available. Number 5, which you designating a family member to be your spokesperson. Keep in mind that HIPAA exists now. HIPAA has been around for quite some time, and HIPAA is there to protect the patient's information. That's why it's so important to have a designated person, because if there's no designated person and you have 3 and 4 people calling, no one will get the information because it's the patient's privacy. I also have it in my blog at mybloominghealth.blogspot.com. Continue to follow me. If you have any questions, please do comment below. Let me know, and we can chat about it. I will talk to you soon. Have a great day.